Good evening, everyone. Thank you for joining us today on a discussion on getting back to work after stroke. We know that stroke is a leading cause of disability, and we know that over the last few decades, the incidence of stroke in younger people is rising. We will talk to Dr. Rajesh Kumar Songa, neurologist, Malla, Reddy, Narayana Hospital, Hyderabad, and Mr. Sanjay Srivastava, HR Director at Boehringer Ingelheim, India, on this topic. The intent of this discussion is to start the ball rolling on this issue of returning back to work. What are the challenges that patients face, and what can the industry do to support them? This is part of a series, No Stroke for No Stroke, a public awareness initiative by Boehringer Ingelheim India and Patients Engage. Quick reminder that Patients Engage is an online platform where we seek to ensure that people are better informed and they feel confident about managing their condition better. And also they are aware that they're not alone, that's the most important thing. So our motto always is inform, engage, empower. We have been doing this as part of a series. So we've discussed previously a few topics like the effect of gender on stroke and how it affects men and women differently. We've talked of stroke management and rehabilitation with Dr. Raul Chakor and Mr. Hardeep Sodhi, Mr. Sodhi runs a support group for stroke. We also talked of how to prevent stroke recurrence with Dr. Arun. And next Friday, we talk about stroke recovery and effect on mental health and vice versa. And a quick reminder to our audience that the views expressed in this video are of the physician and the panelists and are only intended for spreading general awareness. They do not necessarily reflect those of the publisher and or sponsor. As well as to remember that this does not replace a medical consultation. So please do consult your doctor for specific medical issues. You can reach us at any point on our social media channels, on Facebook, Twitter, Instagram, as well as LinkedIn, YouTube. And this currently is being live streamed on the Boehringer Ingelheim Facebook page, Patients Engage Facebook page, and LinkedIn and YouTube. And if you have any questions, you can ask us during the session or subsequently, and we will try and address it. And I'm Aparna Mittal. I'm the founder of Patients Engage and the moderator for this session. So let's get started. Thank you, Dr. Songa and Mr. Sanjay Srivastava for joining us today. Dr. Songa, if you can start by just quickly doing a recap on what is stroke and what is the common age for stroke incidence.
Yeah, thank you for having me. Stroke means dysfunction of brain or spinal cord due to interruption of blood supply to the brain and spinal cord, predominantly brain. Okay, when one blood vessel supplying the brain gets blocked or ruptured, then blood supply to that part of the brain gets interrupted and it starts malfunctioning and stops functioning. So we can see the symptoms in the form of weakness of one side of the body, or speech disturbances, or language disturbances, or visual disturbances, or any balance issues. Usually these patients present with these kind of symptoms due to dysfunction of brain caused by blockage of blood supply to the brain. So usually we see stroke predominantly above the age of 50 years, or who has comorbidities like hypertension, that is high blood pressure, diabetes, or that is high sugars, or cholesterol, high levels of cholesterol. But these days, due to various reasons, we are seeing young strokes also, that is between 18 to 49 years of age, due to various other phenomena.
Right. And since we are seeing younger people in that age group of 18 to 49, obviously these are people who are employed. Most
Yes.
of them are in the employable age group. Sanjay, how does this affect our workforce, and what is going to be the impact due to the increase of stroke incidence?
Yeah. So first of all, thanks Aparna for having me on this forum. I think if you look at the workforce from a workforce perspective, definitely we'll see productivity loss. Some of the patients may carry specific skill set, capabilities, and then we see a erosion there. So clearly, these are the two things that we are seeing, and of course, it kind of impacts the morale also to some way when people hear that somebody is getting stroke. So this is kind of prevalent. So these are some of the things that kind of gets into the workforce as we go on.
Right, right. Dr. Rajesh, you talked of basically the BFAST symptoms related to stroke,
Yes.
starting with balance to uh, and all of the others. What are the common disabilities and impairments that are normally noted after a stroke? So, what are the most common disabilities that people face, or maybe not even most common, but what are the common disabilities?
Yeah. To the usually the common easily noticeable disabilities are weakness of the limbs, that is the weakness of hand, legs, which causes the mobility issues, moving from one place to another, or using their hands, that is so this is the most common symptoms. And along with that, not commonly seen or not easily understandable are speech difficulties. That is a difficulty in expressing themselves, or slurring of speech, decreased clarity in their speech, and also language issues. That is there is a difference between speech and language. Language is where in the language which we use to communicate, that is a motor form of the speech. Speech contains understanding also. So understanding the speech is also can be difficult in some certain kinds of strokes. And also visual problems, also balance issues. Even though they on bed they look fine, all their limbs are moving, having seems to be having a good power, but once they starts moving, they will notice the some kind of balance issues. So
Right.
these are also they can affect the workplace performance.
Right, right. And in terms of the one question I do want to ask is, we know that time is very important for a stroke, right? So once you see the symptoms, there's the golden hour during which you need to reach a stroke-ready hospital. But does the time to treatment also, the longer the time, does it increase the subsequent disability? Is there a correlation there as well?
Yes, there is a definite correlation between the treatment onset and long-term disabilities. It's quite established and evidence-based. As soon as the blood supply to the brain is blocked, then the neurons starts to die. So as the time to start the treatment gets delayed, the more number of neurons will be dying. So that if the more number of neurons become died, then the recovery obviously will be very late, and will not be as good as the those who started early treatment.
Right.
So initially when the blood supply to brain is blocked, initially the center core neurons will be got died, but around the core of the infarct there will be some tissue, what we call in medical language penumbra. It is still having a low blood supply, but those neurons are not died. So with the treatment, with the available treatment, that is thrombolysis, we rupture, where we recanalize the blood vessel with the injection. Those neurons in the neurons in the penumbra, which are getting low blood supply, but those are not still having not died. So those neurons we can save. Those are helpful for early recovery. Those neurons
Right.
will contribute to the early recovery. The wonderful feature about the brain is plasticity. Even though some neurons are died, the remaining neurons can rewire themselves and they can relearn the lost activities. So we should as early as possible should reach the stroke ready hospital and get the treatment if everything if he is eligible for that thrombolysis. And we'll have to minimize the damage to the neurons.
Right. Right. And just on that, the effect, also the role of therapy is to some extent or to a large extent neuroplasticity as well, right? So that even therapy, the post-stroke rehab therapy also helps in rebuilding those
Yeah, yeah.
neuron connections and so on. So if you can kind
Yes.
of highlight
As
that.
yes, if the more number of neurons are still still there, if we can prevent the more number of neurons from dying from the stroke, then the recovery will be a lot better. The plasticity will be easy compared to the less number of neurons to control the entire half of the body. Then now more number of neurons can actually control the body. So the accuracy of the functions after the recovery, and that will be great if the therapy has been done in the correct time.
Right, right. Thank you. So in terms of Sanjay, in your experience or based on what you've kind of understood, what are the challenges that are faced in going back to work after a stroke by, by patients who have gone through a stroke?
I think as I was hearing Dr. Rajesh, clearly if there is some part of memory that goes away, or there is a speech difficulty, understanding the language, and restricted movement, these will create issues in terms of going back to work, and it depends on how much time it really takes you to kind of recover and to what extent. But I think one would be definitely the patient starts with a low confidence, a low morale, and going back to work becomes a challenge. So, it has to be gradual. I think there has to be a clear understanding by the employer. First of all, a lot of people don't understand what stroke is. They often confuse that with a heart attack. I mean, the awareness is so low. So, clearly communicating to the employees and the employer, saying that what stroke is and what does it mean for a patient, so that they really understand, what is going through the patient's mind, how's the patient feeling. And also the second part of it is the acceptance by the employees and the organization.
Mm.
Saying that this is something that can happen to anyone. It's more external, and the person is not really responsible for that. So how do we bring a very different mindset to look at this, both from an organization and people perspective? And we should not attach any kind of a stigma
Right.
to people who go through this.
Right. So obviously it will require, there is, as you said, there is loss of confidence. There may be certain disabilities. So sometimes, and I think we were talking earlier with Dr. Songa that, it may require, and Dr. Songa, maybe you can first talk of how in some of the cases you advise a change of role for patients. So if you can tell us, or give us a few examples on that, then we can take up that discussion.
Um, uh, Depends upon the present role the patient is going. If the patient predominantly in the field role are having to deal with the any missionary kind of things, heavy missionary or as in driving kind of things, so we advise them to shift to less intense jobs like desk works, which in his capacity. uh, Usually we advise the management and the patient himself to request for the management to, if possible, for at least some time before he completely regains his motor activity. So we have seen so many patients, especially drivers, who lost their jobs due to this stroke, where they require very fast reflex actions. In a day to in a minute to minute, within seconds they have to react to the conditions. So their motor disability can prevent them for doing so. So at that time, we usually advise them to shift to a less intense jobs where they can do well in their capacity, which they can do.
Right, right. And I think what we also see is there are a few other things that people are trying to reduce, right? So doctors typically will tell them reduce stress
Right.
in your
Yes, yes.
job. They will tell they need to spend a couple of hours each day on therapies, physiotherapy, speech therapy, etc. If their speech is affected, even in office kind of jobs, it may require, if they're going to be a lot on the phone, then that's an issue. So, Sanjay, how do you think the organization can take these into account and help a patient or a stroke survivor ease back into the workforce?
I think organization, I feel like needs to take a very customized approach, which will be very, individual centric. And, if somebody, as Dr. Rajesh was saying, if somebody can't do a field role, then how can we move that person, give a change of role in the office? If somebody, let's say, is working in a technology sector and let's say has to use a lot of brain power for coding and so on, is there an opportunity to look at a different role? So that's one, a piece of it if the roles change. The second piece is about saying that, let us also not expect somebody to come, somebody was doing 100% and then, we can't expect somebody to come into the organization 100%. So we have to look at, okay, how do we start that employee, let's say, with incremental improvement and see how we can, and you're also talking about stress. So we start with, let's say, only doing, let's say, 40% of the job or 30% of the job, and then slowly see where the patient, the individual is and how we can build that. The third thing is also about flexibility. I mean, every organization post-COVID is talking about flexibility and a hybrid work. I think it will be tremendous benefit for the individual if they can given that flexibility to work from home, couple of days in office, and then that helps them to kind of if they are consulting their physicians and all the other infrastructure is in place, so that gives them that flexibility and the opportunity to look at things. I would say these are a couple of things that definitely the organization should look at.
Right. Dr. Songa, anything else that you would like to see, organizations add to what Sanjay has just talked of? Again, based on your experience with patients.
Yeah. Also from the physical, rather than from, even though there is a support from physical point of view, role change, and there should be an emotional support to them also. Maybe counseling, in-house counselors. I think there is some kind of rule to have a in-house counselors. So we tend to focus more on these physical level communication issues and all, but there is also a lot of emotional things also has been involved, which in turn improve if the emotional quotient, emotional component has been taken care, then the physical and the communication point of also there will be improvement. So that aspect has to come from, then there should be some kind of reassurance from the management side, so regarding their job security and all, once they became physically fit. So these kind of things also help. And regarding the leave policy during that phase of acute illness, so these all things from the management side will also help in the long-term improvement of the patient. Right. Or maybe giving time for rehabilitation, less work hours in the initial phase. So these type of incentives the patient usually expects when we communicate with them during the post rehabilitation. These patients are expecting these from their employers. Yes.
Right. Sanjay, anything you would like to add to that?
I mean, just kind of adding on what Dr. Rajesh is saying. I think once somebody goes through the stroke, it creates a big impact on the person, and then the loss of confidence. So I think it's very important for the employer to make sure that they kind of build that confidence back by providing them the job security. A lot of companies now have counselors, coaches, mentors who can regularly talk to these people. Because I think the fight is very different. The fight is how do we get back to a normal life, that becomes a real challenge. So how can, the coaches, the mentors, the counselor can really work with them to provide, look at what are the needs, how can the support more from an emotional perspective can be provided. I think those are important, and the additional infrastructure of, the, as I was saying, the flexibility in terms of leave, in terms of making sure that the person is not feeling stressed with the role. So we'll have to take a very a slow and steady approach to help the individual, the income.
Right, right. The other thing also, I think we need to recognize always is that, in our country, social security is an issue, right? So if this person is a significant earning member of the family, then the loss of income affects not just the person, but his or her family as well. And that I think therefore also means that they can't pay for ongoing rehab, and so many other factors start to come in. So I think that's another reason why we do need to look at keeping people employed as long as possible and as much as possible. Dr. Rajesh, in your experience, when you talk to patients who, you did mention financial security, but what do you see as the impact on the family unit?
Um,
Their
yes, I
children,
mean,
their
yes, yes.
their parents, and all of that, right? So
Stroke is still a social cause, very much social and social stigma. So, and it also impact the interpersonal relationship ship of the family members, because these modern day jobs require both the partners to work almost continuously, so along with the family responsibilities. So if one person has this kind of disability which requires continuous support from the other partner, so all other routine activities and each other person job also will get affected, work hours and all, because the other partner has to be also with them. So both the persons, I mean, when the stroke survivor and his partner also will get affected. So along with that, at the time, I can see, I mean, I have seen the case, a lot of broken families regard because of this stroke also. Families become dysfunctional, and also we need, along with the patient itself, we need counseling for the entire family together regarding the stroke. It can be dynamic. There is a process is slow, but the patient, usually the patient, especially young patients, have a lot of plasticity in the brain. So they can recover well. They are able to, they can be almost normal. So these kind of reassurances from the treating physician and from the work colleagues and family members, counseling them is also very much important.
right.
I feel.
Right. We've just got a question, which is that, is there a way we can provide support to caregivers of a stroke patient, right? So not just the stroke patient at the workplace, but the partner, as Dr. Songa was saying, that, he or she may also need some level of extra support at the workplace. So is that, again, any thoughts on that, Sanjay?
Yeah, I think that's an important point, because you have to, it's not the individual per se, but also the family who's involved. So,
I'm sorry, just to clarify, it could be a partner, it could be a parent who was, who's a
Yeah.
stroke patient at home. So, yeah.
yeah. So at least at the immediate level, and organizations looking at, if somebody goes through a stroke, the immediate family, how can they be supported in terms of, depending on what support they need, maybe a financial support, emotional support. Uh, Also, I'm just thinking that they may need a leave of 2 months or 3 months. Our organization is ready to look at that. So we should also kind of consider that if somebody suffers a stroke, pretty much the next 3-6 months, the person will need help. And if, let's say, both the partners are working, then how do I support as an organization? So those are some of the things that we should look at, both
Right.
financially and emotionally.
Correct. Yeah. So, and what kind of reasonable accommodations can be made both for the person affected as well as for a family member? Because I think increasingly, as the incidence of NCDs grows in the country, we will see more and more disabilities, and ultimately it doesn't just affect the person, it affects the entire family unit and the family caregivers as well. So I think we do need to look at that. Any other points that you would want to add, Dr. Rajesh, on this discussion that we've had? One other point which we didn't touch on, and I know that it's a whole new whole area, but Dr. Rajesh, if you can just quickly mention the disability options that you are aware of that may be available to stroke survivors. What they should do, because often they don't even know that there is something, right? So if you or should they, like you said, you sometimes write notes for their management. So is that something
Yeah.
that not every stroke patient knows that they can ask their neurologist or their treating physician to write a note for them?
Yeah. Usually patients in their follow-ups and during their rehabilitation phase, when we are consulting, they will ask for the occupation, options they have, depend upon their ability to their motor or functional ability, I would say functional ability. So usually recommend them based upon that. After hearing their job description, we usually recommend their alternative job option. So most of the institutions, even though our recommendations doesn't hold any legal value, but most of the institutions will kind of will take account of our recommendations. So depending upon their policy in place, they can actually do what they can accommodate in which better way possible. So it kind of gives eligibility for the patient claims, disability claims, even patient. So that way it can be transparent. Um, that's I would say.
Right. And would that also, I know that jobs for persons with disability so we are talking largely of coming back to the same organization. But,
Yes, yes.
if you're having to look for a new job completely for whatever reason, that organization is not, or you took a long leave because you couldn't even manage to go back part-time or whatever, then, a year later, 2 years later, you try to get back into the workforce. Are these people eligible for the quote unquote the jobs that are available to persons with disability, or in your experience, Dr. Rajesh, that's not so easily available as well? Our
Yes,
feedback is that it's not.
yeah, yeah. Yeah, especially when any organization willing to give a job to someone, they want a fit person, especially if they're looking for a new person for a job. So what from our perspective we can provide, if he's it's a stroke is a dynamic process, like you said, when at the time of first employment he may be having major disability, but with the proper rehabilitation he might have recovered well, almost to the normal levels. Then we can usually we mention in our records or consultation papers that he is now fit for a job, or he can now start driving, can drive, or he
Right.
can those kind of things we will mention, depends upon the patient the status, what so that way the management can take a
Right.
information that patient is
Right.
from having from the expert opinion. So management can have an information. That's one thing.
Right. Sanjay, from your perspective, what do you see as potential steps that the industry can take in this regard of helping people with stroke, after a stroke, to get back to work? We've talked of a few things, but if you look at a few action points that we should be looking at, what would you put them down as?
Yeah, I would say that look at it from an individual's perspective first. Is uh, the mental health, the physical health, well-being that the person goes through, understanding of that. So first, I think from an organization perspective, A would be acceptance. B would be how can we be inclusive in our ways of uh, welcome the employee back into the workforce, or provide him or her opportunities to get jobs, and creating that ecosystem where you provide flexibility in terms of leave, in terms of, as I was mentioning, counselor, coach, in terms of assigning different roles, in terms of providing leave, and then not loading the person with a lot of work, but starting small step at one time and taking it forward. At
Right.
least these are some of the minimal things that any organization should look at doing as a starting.
Right. Right. Okay. Um, Dr. Songa, any final words for our audience?
Yeah. Stroke, I think in a community level, awareness has to be there to know the stroke symptoms, and has to reach the stroke ready hospital as early as possible, so that to minimize the damage to the brain, and so that the patient can come to the functional status as soon as. If in unfortunate event of stroke, the organization has to support the patient or the caregiver, both financially and emotionally also. Depends upon the policies of the organization, and if they are not there, they have to implement as soon as possible, to because with the amount of NCDs, non-communicable diseases are rising, so this will become a pertinent problem in coming days if it is not there now. So we have to be ready with all this in place.
Right.
So also each has to be some medical team in that is also a good idea, to have a medical team for an organization to transparently, independently evaluate the patient for the particular job they are having, or they can also suggest
Right. Right. Okay. Thank you.
having a
Thank
medical
you.
team.
Right. Right. Thank you, Dr. Songa. Sanjay, any final words from you?
I think from an industry perspective, as Dr. Songa was saying, this is something that is prevalent. It's going to get prevalent, and we'll have to take all the steps to make sure that the individuals can have an easy life in the organization.
Right. Right. And I think we also believe that given that, stroke incidents can happen at the workplace as well, so it's also brings in awareness of what it is, what the symptoms are, and what action should be taken. We've also seen sometimes patients wanting to go back home first when they start to feel unwell. But this will also remind organizations that they should help the patient get to a hospital straight away, and reduce the time to treatment. And I think we will become, hopefully, if we become more accommodative of people with disabilities after a stroke, we will also become a more accommodative and inclusive community. And that's absolutely essential. I think a large part of the stigma will go away when people with disabilities are able to continue work and be productive and live reasonably a good quality of life. So thank you so much, Dr. Songa and Sanjay, for joining us today. And we do hope to see and work towards making the industry work on some of these initiatives going forward. Thank you.